Extreme makeover. The table of content are the introduction, learning, outcomes, miscommunication in the workplace, cafeteria conversations, reflect and rewrite, change the story, and the conclusion. Introduction and learning outcomes. Hopefully this presentation will help you to improve your communication skills, how to bring new innovations to make your organization a greater place to work, and how to be a more effective listener. Mission statement and core values. At the VA, we President Lincoln promised to care for him who shall borne the battle, and for his widow and his orphan, by serving and honoring the men and women who are America's veterans. Our core values is I care, which stands for integrity, commitment, advocacy, respect, and excellence. Miscommunication. During a procedure, the nurse anesthetist was ready to start a procedure. The nurse went to go get the physician. She told the nurse anesthetist that she would ask the doctor if he was okay as she was walking out of the procedure room. The nurse anesthetist assumed that the nurse was stating that she was ready to start the procedure. So by the time the nurse and the physician got back to the procedure room, the nurse anesthetist had already put that patient to sleep without the patient signing a consent form, without the doctor going over the risks and benefits of the procedure, and without them doing a proper timeout. The variables that led to the miscommunication is it was poor communication between the nurse and the nurse anesthetist, with the nurse talking or answering her question without looking at the nurse anesthetist face to face. She answered a question walking out the door and leaving the patient alone with the nurse anesthetist. The nurse could have, instead of leaving the room, called the doctor's room to let the doctor know that they were ready to get started and if he was ready to come on back to the procedure room. So the nurse anesthetist was ready to get the procedure started. The nurse stated that she would go get the doctor. She left the patient in the room with the nurse anesthetist. When the nurse and the physician came back to the room, the patient was asleep under anesthesia care without signing a consent form to have anesthesia and stating that they were okay, understanding their risks and benefits of the procedure, not being able to ask the physician any questions about the procedure prior to being put under, and not doing the timeout procedure just to make sure they have the right patient and that they're doing the right procedure. Lunch cafeteria conversations. Most staff talk about being overworked and overwhelmed. The staff feel unappreciated in the department. This entails make the morale in the department very low. Staff complaining about the workload. Staff having negative conversations about other staff members. This is not a healthy culture environment for an organization to be great. We must set clear, attainable goals for the staff. Some staff members don't work well together. It hurts the morale of the organization. If they have to work as a team, maybe they're not communicating with one another, talking, saying, hey, we're going to need this, or no, we're not going to use this today. What we need to do is to strive for the highest quality and continuous improvement of care for the patients as well as for our organization. For maximum clarity as far as communication, we need maximum clarity. Be natural so that the real you will come out. People won't feel like you're being underhanded, and they are sure that you're transparent. Make it clear that you're interested in what the other person has to say. So that means showing interest is that when that person is speaking, that you stop doing what you're doing, that you look them in the face. If you have any questions, let them finish their statement. You can rephrase what they said, repeat what you thought that you heard. So if you were incorrect about anything, that they can correct you. Reflect and rewrite. With this incident, as far as the nurse anesthetist, if the nurse in the room had stated to the nurse anesthetist, first, what we do in our procedure room is that the doctor has to be present in order to do a timeout. The doctor has to talk to the patient, talk to them about the risks and benefits of the procedure to make sure that that patient wants to continue with the procedure. The patient, first and foremost, needs to sign their consent form in order for the procedure to be done legally. So that way, if the nurse and nurse anesthetist communicated properly, then this incident would not have occurred. Again, we have to listen to what each other is saying plain and clearly.